So as soon as he can join me in the studio, I will link him up and we will talk. All right. So the questions I had for the doctor today were actually the updates on the COVID-19 virus. Okay. This virus, like we all know, originated from Wuhan in China. And before we knew it, it spread all over the world. Okay. So the concern now, the many questions is, the many concerns with the virus is that it seems like it's, becoming or mutating into different forms when it reaches different areas. For example, there is news that the strain of this virus that was in the UK was more virulent, and also the strain that reached America was much more virulent. That is, it was more infectious than the one that originated from China. Another thing is that news on this virus keeps changing. First, we thought that it was just airborne, and then we hear that it could be suspended in the air for a long period of time. It could be suspended and it could live for a long period of time on different surfaces in different enclosures. So we had to incorporate the way we protect ourselves and protect our patients with the new information we got from the CDC regarding this virus. Another thing that has changed with this virus is it's like every time we turn around, there's new information that negates what we once knew about it, and then everybody has to fall in line, okay? Another thing is there's a new approach to treatment protocol. Scientists think that the ventilators hurt us more than, do more damage than good, because it was found that 80% of, I can't be sure of the figures, depending on what part of the continent you are on, too many people that were put on ventilators, did not make it back. And they thought that evidence presented showed that it wasn't really, or there wasn't really a need for ventilators as much as there was need to revamp the oxygen carrying capacity of the system. So based on that, treatment protocol was also changed. New discoveries show that when this virus invades the body, it causes a lot of blood clots to be formed in the body. And then when a blood supply is blocked by one of these blood clots to different parts, we can see organ failures, like there will be a heart attack or stroke or deep vein thrombosis, DVT, and pulmonary embolism and all that kind of presentations. Because of the fact that the virus causes the blood to, form small blood clots around the system. And anticoagulation therapy was introduced to the treatment protocol. I was hoping that the doctor will be able to tell us about updates in the treatment protocol on how we handle patients that have been exposed to this virus or to this infection. Dr. Sowemimo is a bariatric surgeon. He specializes in obesity. Something else that we know about this virus is that I'm reading your questions and comments, so please keep them coming. Something else we have learned about this virus is that people who are obese do not really do well with the infection by this virus, because they already suffer from a condition called hypoxemia, all right? Hypoxemia is when your body is not able to really carry oxygen to different parts of your body. They already have that, and here comes a virus that affects the way or the oxygen carrying capacity of your blood. Definitely, they will have more problems than the people who are not obese. So in the light of all this, how are we going to change our approach to protecting ourselves and protecting our patients? What things should we incorporate in our everyday lives to take care of ourselves? First of all, the story on the vitamins was not a joke, okay? Because vitamins help keep your blood light. Vitamin C, vitamin D, vitamin E. It's also been found that if you have lower levels of vitamin D, you are not going to, your immune system is not going to function properly in protecting you from an infection by this virus, okay? Vitamin E especially has been found to keep your blood thin. Aspirin, baby aspirin every day also helps keep your blood thin. So if you're going to put together a regimen to take care of yourself, consider adding all these vitamins and not just using them for decor, staying on top of it and taking your vitamins, okay? All right. Now, for those of us on the unit, the anticoagulation therapies, you see, you would notice that we have gone really into giving most of the patients Lovenox, right? Lovenox helps keep the blood thin also. It looks like the doctors are really big on preventing the circulation of this blood clot. So anticoagulation therapy has been added to the oxygen therapy. So we have the oxygen therapy, the anticoagulation therapy, and the use of ventilators are like the last resort, okay? So a school of thought is saying that ventilators are a no-no because there's nothing wrong with, your body being able to take in oxygen, but there's everything wrong with low levels of oxygen. So ventilators are not really, the darling of this treatment protocol as they once were, all right? So in not being able to bring in the doctor to talk about this, I am going to close by reminding everybody of the COVID social etiquette. If you can say it with me, I would appreciate. What is the COVID social etiquette? Maintaining your social distancing. That is 6 feet apart, all right? Put out your hands and make sure that nobody's coming too close to you, invading your personal space that is now 6 feet apart. Maintain social distancing, maintain hand washing, use your hand sanitizers, maintain hand washing, okay? Disinfect everything that, you come in contact with. In terms of when you bring your shopping bag home, disinfect them before you bring them in. Make a bleach spray, add some bleach to water and spritz everything down before you bring it into the house. Use an alcohol-based hand sanitizer. Don't forget that, okay? And stay on top of good nutrition to boost your immune system, all right? Prep for this virus like you were prepping for a major flu, okay? All your garlic, your soups, your ginger, your lemon tea, your sorrel tea, all those things will come in handy to help you take care of yourself if you have mild symptoms of this virus, okay? Now, if you have underlying conditions, like we always say, underlying conditions like high blood pressure, obesity, diabetes, cardiac disease, please don't play if you have these symptoms, okay? If you have symptoms of temperature, symptoms of body pains, difficulty breathing, please go to the hospital if you have underlying conditions. But if you do not have any underlying health conditions and your symptoms are mild, you can manage it from home. Now, let me say something that has been pointed out by the doctors. Sometimes when you measure your oxygen with your pulse ox, the thing that reads the oxygen level in your blood, it might be reading like, 90%, and suddenly, you drop, you're not able to breathe, they rush you to the hospital, and we find that you are at 50%. It so happens that people would have symptoms, or people infected by this virus could be showing like nothing is going on with them, be presenting like nothing is going on with them, they're able to breathe, and then suddenly it hits them like a ton of bricks. They're unable to breathe, they're unable to talk, they're unable to, maintain a normal presentation. It is something that has been noticed with the infection of this virus, that you can change like that, all right? So we have to stay on top of what we are feeling, document your symptoms and stay on top of what you're feeling, and don't wait until you drop before rushing to the hospital. Be in constant touch with your primary care provider, with your doctor, and discuss your symptoms with him, okay? All right, I am going to make sure that I'm able to bring that doctor back as soon as I can so that we can answer all your questions and go through updates or new information reaching us about the effect of the COVID-19 virus so that we can better protect ourselves, our patients, and our communities. Okay. Another thing I want to talk about is the conspiracy theory. All right. The conspiracy theories that is keeping so many of you from from listening to important information, the conspiracy theories that is accompanying the vaccines, the conspiracy theories around Dr. Fauci and Bill Gates. I would like to talk about all that in a subsequent episode. So be sure to stay tuned, okay, to your Saturday online program. It was a pleasure to have you with me today, and I look forward to seeing you soon. Thank you very much. Doctor, you're now on, just like I of the program you came on. I said bye-bye to everybody and you came on. All right, let's just have a conversation, okay? We'll have a short conversation and we'll take it from there, okay? Dr. Sowemimo, it's a pleasure to have you with me, okay? So I did my best to talk about the virus, talk about the updates that, CDC is giving us on this virus. Can you introduce yourself to the viewers, please, and we'll take it from there.
Yeah. Good morning, and first of all, let me just apologize to you, Regina, and to your viewers. This is one of those things where I guess the lesson learned is taking on new technology. So the new app, I put it on my Safari, and for some reason it didn't allow it, so I had to go and get a whole new browser on Chrome, and apparently Chrome is compatible with sharing screens and things like that. So we're learning something new. But my name is Dr. Seun Sowemimo. I'm a bariatric surgeon and general surgeon in New Jersey. Bariatric surgery means I will operate on people who have significant weight to help them lose weight. This has been an area of interest for me. So I work with people who are obese. And as you all know, obesity is one of the significant risk factors for those people who come down with critical illness with the COVID-19. So I've really studied and followed a lot of the science.
Good. So why? I'm loving this discussion now. Why is it so deleterious for them to have this virus?
Okay, so there's a group of diseases that we will call chronic diseases. Mm-hmm. And they are all sort of related. They are all sort of associated. Mm-hmm. These chronic diseases include obesity, heart disease, high blood pressure, diabetes, and even some cancers. They are related because they are diseases that are based on a certain level of chronic inflammation in the system.
Yes.
And these diseases are more common in the West. There is also a link to diet, which is also interesting. Mm-hmm. So this group of diseases put patients at high risk for COVID-19. Why do they put patients at high risk for COVID-19? The patients that have a severe disease with COVID-19 are those patients who have this inflammatory reaction. Mm-hmm. I think some of you might have heard of what they call the cytokine storm.
Yes.
In the critically ill patients. Yes. So it's not hard to imagine that patients who already have chronic inflammation and diseases that are associated with chronic inflammation are the ones that get a hyper reaction to this disease, where the people that have severe disease are ones that have chronic inflammation.
Okay, doctor. Cytokine storm. We are all boosting our immune system so that it will be able to fight off infections, right?
Correct.
When our immune system is that powerful, is it not more likely to stage a severe cytokine storm in fighting the invasion?
Yeah, so the immune system will help defend against the virus, the invasion of the virus, so to speak, mm-hmm. right? So it will not allow the kind of reaction that you're seeing as a result of the virus to take place. Okay. Because you got to realize the virus comes and attacks the cells in the lungs. I mean, we all know that most of the transmission is by droplet through the airways. Yes. And when it settles deep down in the airways, what it does is that it attacks one of the cells in the lungs called a type 2 alveolar, mm-hmm. right? It binds to the receptors, it gets on inside the cell, and then starts to replicate itself. Mm-hmm. If you have a competent immune system, you can minimize that.
Okay.
The thing is that by the time you get to the stage where inflammatory cytokines that are being produced by the cell once the virus takes it over, when those inflammatory cytokines are being produced, if you have a situation where you yourself at baseline are already producing inflammatory cytokines,
Yes.
then that process gets exacerbated.
Okay. Okay.
Yeah.
So why are Black people more susceptible to this infection? And
Well,
is it the same? Is it the same for Black people in America and Black people in Africa? What is
very
the
good question. Very good question, Regina. So one of the things that I have noticed is that Black people in Africa were not seen as heavy a disease there as here.
Why? Yes.
And one of the reasons are that Black people in Africa, what do they mostly eat? We mostly eat plant products, vegetables, things like that. What's the problem with meat? Like all of us when we were in Nigeria, like you and I were in Unilag, growing up, how much meat could you eat? How much meat could you afford as a student?
Yes.
So if you take the general population in those African countries that are resident there, because meat is expensive, they're not taking as much meat. Okay?
Yeah.
And what is shown with the Western,
yes,
it is heavy in meat and animal products. That's milk, eggs, cheese, fish, meat, shrimps, beef, and all that. You know, it's a more pro-inflammatory diet. And there's more also processed foods, which is also pro-inflammatory. So what's happening is that Africans in Africa, majority of them can't afford that kind of diet, tend to be spared, while immigrants here, you know, that can afford those kind of diets, they're eating the Western diet, like you are, so they're more prone to that. And it's not only the diet. So the diet gives you that pro-inflammatory situation, but also when people live in congested places, you know.
Something is going on with your audio, doctor.
What do you call lack of education, and the language is not spoken. When you go to the healthcare, these are people that tend to go present to the hospital and healthcare facilities when their diseases are already far on. They are afraid of immigration issues. And when they isolate you as a COVID patient and your relatives are not there to interpret for you and things like that, these are little factors that sort of stack up against people who are Black and brown.
Okay, all right. Let's talk about the people in Africa. They already have underlying conditions of diabetes. There's a lot of diabetes in Africa, a lot of hypertension, a lot of kidney issues. So many people are on dialysis. And now with all these underlying conditions, we see the infection rates in Africa are still low. What do you say to that? Is it because there's not enough testing to expose the fact that there is really infection going on? Or is the virus not just being able to be propagated because of the heat?
I think we need to, the heat doesn't really affect the virus itself being propagated by the most common form, which is droplet. The heat will affect things like it being propagated through surfaces. Because it won't be able to survive very long on surfaces in the heat. But as for in terms of underlying disease, you know, the thing with the underlying disease itself is that we may be looking, you and I, as we're in the elite from Africa, we may be looking at it from jaundiced eyes. A lot of people in our generation, our parents that were elite in Africa, were eating that Western diet. We're really living, you know, that kind of life. But if you think of one generation before, where in the farm, they're eating things that are straight from, you know, they grow them, they eat them, and all those kinds. Those are not people that tend to have diabetes and high blood pressure and high cholesterol. These are big man diseases in a sense in Africa. And that's why if you look at, you know, the kind of people that will be affected more in Africa and get more severe, it will be those kind of people. You know, you don't want to go by just what people say commonly, but there's always some element of truth when they said that the people that brought it to Africa, like in Nigeria's case, are people who were able to travel abroad and brought in the disease.
But these people have like a retinue of staff. They have the drivers, they have the maids, and they have babysitters and all. And each of their staff have their own families who live in face me, I face you situation. So imagine the propagation of this infection going on, you know. So I'm thinking that, okay, so the big men who traveled and who got exposed to this virus have brought it home, and now it's spreading like wildfire. What do you suggest to Africans that, or Nigerians, that they would do to be able to protect themselves from here on?
Yeah, so even not only Africans in Africa, but we here as well, we need to protect ourselves. So obviously all the personal protective measures need to be taken very seriously, from wearing masks to washing your hands frequently and not going in crowds of large people, especially in closed environments. This is where one of the things that is peculiar to us as Africans here and at home is particularly a risk. For instance, attending religious services.
Yes.
Because you have a lot of people gathered in a closed environment. But not only that, they're not just speaking normally, but they're also shouting, they're singing. Those kind of things will propagate the virus even more than usual. Because normally the virus can be aerosolized, meaning it can float in the air. They've talked about between 3 to 8 hours. But when you're singing and shouting, you can really propel that virus where it's aerosolized in the air for much longer and goes much further, you know. And then the fact that it's a closed environment doesn't help that situation at all. I remember the example of a church here with a black pastor who really was bragging that he kept his church open and held his service and took pictures and disappeared on the internet. And within a week, this particular pastor was dead from the virus. So that's the thing. So if you're going to be even in a place like that, they should have opened the windows or let it be an open air thing where, you know, the virus doesn't just float around and be aerosolized in the, you know, where people are concentrated. So that's one of the things. Another lesson to learn is from patient 31 in South Korea. One singular patient that spread the virus to about 5,000 people by attending religious services, big ones, what do you call them? Revival services. So they tracked this person down in South Korea. But those are the things that we need to watch out for. So don't go in places where there's large congregations of people, you know. And then the other protective thing is to build up your immunity, like you said. So you have to eat a healthy diet. My personal advice is that you eat more plants, more vegetables, you know, and things like that that build your immunity, and reduce your consumption of animal-based products. Because animal-based products have been shown to have moieties that can cause this chronic inflammation. And as we talked about, it's the chronic inflammations that makes the disease to be more severe in certain populations. Are you still there, Regina? Okay. I don't know if people can still hear me. Okay. So I guess I should talk about some of the questions that are being asked. I don't know if I'm still live, but if I am, someone should put something in the chat. Okay, you can hear me. Okay, so if you put some questions, I'll be able to answer those questions. But in general, where we are with the virus now, I know one of the questions that Regina had asked before we came on the broadcast is that, what do we think is going to happen now that things start to reopen? The truth is that now that we're reopening, some of the curves in the places where this has been severe has flattened out. And we have new knowledge now. I don't think it will be like in the first time where we saw that really steep spike in the disease. Because now, as people go back into their workplaces, they're more conscious. That's one factor that will help reduce the spread. Number two, they're more protective. They're wearing face masks and things like that. So hopefully the spread wouldn't be as severe. And also, not everything has opened up the way it was before the lockdown. Restaurants, you know, and places like that where a lot of people normally gather, restaurants and bars, have not, you know, come back open. And even when they come back open, it's going to be at less density than it was before. And then the other thing is that we're testing now more, even though the testing hasn't reached the kind of limits where the impact will be felt. But as they test more people and they especially test for like antibodies, we'll start to see the patterns that develop in terms of what kind of immunity we can get from this virus. There's a lot of problems that they're experiencing here in the US with that, because some of the tests even are not so reliable, whether they're giving the you know, whether they're giving the immunity that we think. Is it possible to be compromised by the virus and yet not fall ill at all? That is correct. You can be compromised by the virus, as in you can have the virus and not be ill at all. There's about 20% of people that are asymptomatic. And those people can still spread the virus, but they don't have any symptoms, or they have very mild symptoms that even they do not notice. So 20% of people fall in that category, while 80% of people will go on to have symptoms. Out of those, they say about 20% of people will end up being hospitalized, and of which 5% tend to be will be critically ill and may die. So that's on that point. Let me just mention one of the really big points that I think for people that are Black and brown, they need to take a note of. And this is because I've studied a lot of things concerning diets. The Western diet that is animal-based tends to promote chronic inflammation. I can't emphasize this enough. So it is important to minimize the amount of animal-based products that you're consuming. Animal-based products contain moieties like heterocyclic amines. These are things they find when you grill, especially the crust when you grill, and this promotes inflammation. They contain things such as what you call heme iron. Your body needs iron, but heme iron from animal products is not well regulated by the body. So this can be consumed in excess, and so therefore it can overwhelm the body's antioxidant system to minimize its effects. And if it overwhelms the body's antioxidant system, that means it produces moieties that are what you call superoxide, that produce oxidative stress, and that again causes inflammation. There are other things called TMAO, which is a product of choline in the diet, that also increases inflammation. So these are the things you need to minimize. So minimize your animal-based consumption, but then increase your plant-based consumption, because the plant-based consumption is things that gives you antioxidants and anti-inflammatory properties that will help mop up what you call excess free oxygen radicals. How much herbs can be consumed? Garlic, ginger, turmeric mixture. Well, you need to consume these in moderate quantities. Each of them have, limits that you don't want to go beyond. But in general, if you want to substitute salt in your and use these spices, it's more beneficial, because these spices tend to contain bioactives that are anti-inflammatory and that are antioxidants. So that is useful. Okay, so are there any other questions that I can take on the subject? Any things that people would want to know about COVID-19, and as we head into reopening the society, what precautions to take? As I said, my general advice is for people to look out for yourselves. I know that there's different governments and state governments are coming out with different parameters and things like that in terms of reopening. But this is a time when you need to, beyond that, beyond whatever policies are formed, use knowledge yourself and protect yourself as you go back out to your workplaces and everything. Make sure you're safe yourself. Make sure you build up your immunity through eating right, through exercising. Make sure you protect yourself by wearing face masks, by wearing gloves if need be, by washing your hands, frequently. Avoid large gatherings. Especially places like packed bars and restaurants, places of worship, any place that is closed or that is enclosed where the virus can spread easily. Steam inhalation. Well, if it's not harmful, you can do a steam inhalation, but I don't think, the amount of, that will help you if you had immediately inoculated yourself with the virus and then you do a steam inhalation, then that may physically sort of inactivate some of the virus. But it's not something that I would advise in a dangerous circumstance. You don't want to expose yourself to fire or anything like that. If the normal kind of steam inhalation you do from time to time, especially if you think you've been recently exposed to the virus, then that is fine. I don't know that rub or menthol or any of those other things, help with getting rid of the virus. And please, please, please don't ingest any Lysol. As ridiculous as it may seem, some people hear these things and then, still go ahead and do that. Yeah, so question is it true that those that have recovered have a higher resistance to the virus? This is true in general. Extrapolating data from previous viruses, Ebola, MERS, and things like that, there's something called convalescent plasma. That is antibody that has been developed by the body by those who have been infected with the disease. So what is happening is that right now we don't have information that is specific to the COVID-19 to know whether this convalescent plasma really confers immunity, because it depends. It depends on a number of things. First of all, there might be different mutations of the virus, and you have someone that has a particular mutation and developed antibody to that, but it's not the same mutation in someone else. So you can't, until we've studied more, we can't know exactly about in terms of the mutation. And then even though you develop antibody, the question is, what level of antibody resistance is that is developed? Is it such that it can completely knock out the disease in your body? Or is it such that if the disease were going to be 90% severe, it will bring it down to like 40% severe? So those questions are yet to be answered. But those are one of the things where, as we gather more information, as more people are given the convalescent plasma, they will know what those levels are. The difficulty is that in doing the testing for this, usually you want a test where you take a group of normal people and who you give something called placebo, which doesn't have the drug, and then you take a group of people as well that you give the drug to and you compare them. But you can imagine in a situation like this, who will want to be the one that is giving the placebo? So it's difficult for them to test in a randomized way. So they end up giving everybody that they can the convalescent plasma. If they extrapolate the results in terms of giving convalescent plasma from the flu, it didn't have much of an effect. But we're hoping that with this particular COVID-19, that we'll see a positive effect. And once they see that positive effect from the convalescent plasma, what they can do is isolate that particular antibody that is giving the positive effect, and then use mononuclear methods to replicate those antibodies and have that to be commercially available. I know that Bill Gates Foundation is working on that. That once they identify what antibodies are really working, they will mass produce it. Okay.
I'm sorry, I have to apologize for that. I hope you can see me. I'm so sorry. And you held it down so well. You held it down so well. I was losing my mind back here. Thank you so much.
No
All
problem.
right, there's another question that's asking the efficacy of cloth mask. Is it the same protection as the other mask that is commercially produced? And also, are the symptoms for children different from the symptoms for adults?
Right. So the cloth masks are definitely not of the same efficacy as the surgical mask or even of the higher grade mask like N95. Cloth masks, there's no uniform whatever. People are making cloth masks with Ankara, with Ashoke, with all sorts of things. So there's no uniformity in that. So we just don't know. But we don't think they're of the same grade as medical grade masks. Surgical masks are even of a lesser grade, actually, than like the N95, which really prevents up to 95 or more % of pathogens coming in. The purpose of the cloth mask, however, is to minimize the droplet spread from people so that if you should have the disease, you don't spread that droplet. And it actually increases the efficacy of that if everybody is wearing a mask, because then you're not able to spread the droplet, and on the receiving side, those who are exposed to that, also their chances of receiving those droplets are reduced.
Okay. Symptoms in children. They used to think that this disease doesn't hurt children, but we're seeing that a lot of kids are, the disease.
I think one of the things is that we always tend to think of things in terms of all or none. So when they say this disease